Hi, my name is Brittany Williams, and today I'm going to be performing the skill of inserting a NG tube. So first, I'm going to verify the physician orders. Then I'm going to knock on the patient's door, close the curtain or door for patient privacy. I will then introduce myself, and then I'm going to verify the patient by asking them their name and date of birth, and then verifying the wristband. Next, I'm going to perform hand hygiene. I'm going to put on my gloves, and as I'm putting my gloves on, I'm just going to describe to the patient what we're going to be doing today. So, hi, Mr. Smith. Today, your provider has ordered that I insert an NG tube, and that's just going to connect from your nose to your stomach. It's going to hook to a suction, and it just helps to help clear out some of that stomach contents. Okay. So, the supplies I have is gastric tubing. I have my 20 to 60 syringe, towel. I have the padding down ready under the patient, pen light, tissues, basin with warm water. I have my water soluble lubricant, my tape. I have a specimen cup with the pH test strip, safety pin, and a cup of water with a straw. Okay, so first I'm going to inspect the patient's nostrils and nares, and we're just going to look for irritations, abrasions, deformities, or any obstructions. Okay, so I'm just going to have the patient look up as I inspect. All right, and then I'm going to have the patient take a deep breath out of the left nostril and out of the right nostril. Whichever one has the greater airflow, that will be the nostril that I'm going to insert the tubing. So I'm going to go with this left one. All right, so next I'm going to place my tubing in some warm water to prep it. While that's doing that, I'm going to put my patient in a comfortable high Fowler's position. Okay, so he's in a nice position. Now our tubing is ready. Next, I'm going to measure to see how far we're going to insert this. So we're going to go from the tip of the nose to the tip of the earlobe, down to the xiphoid process, and we're going to mark it at 50. With some tape. Okay, so we're just going to set that aside for a second. Next, I'm going to place the towel, drape it over the patient. Okay, so next I'm going to ask the patients to hold their hair back and look up. I'm going to lube the tip of this. And you want to get it nice and lubed. Then I'm going to instruct to the patient that I'm going to insert this with the natural curve. So we're going to be going down towards the floor of the nostrils. If you feel any resistance or anything, then that just means you need to come out, re-lube, and try the other nostril. So once I reach the back of the throat or the orphanix, we're going to ask the patient to lean forward and begin to take sips of water. So as they're sipping water, I'm going to advance the tubing 2 to 4 inches more with each swallow. All right, so patient's head is back, he's looking up. I'm going to insert. Okay, so now that we reached the orphanix, I'm going to ask the patient to lean forward and give him his water with straw. So as he continues to sip on the water, with each swallow, I'm going to advance within 2 to 4 inches until we reach our mark. And remember, this is with each swallow. If the patient is feeling not like they're gagging or just uncomfortable, we're going to instruct the patient just to raise their hand, and we'll, we can take a couple breaths, another sip of water if needed. All right, so now that we're in, we want to make sure that our tube is in the stomach. So to do that, we're going to you check the placement by the facility's policy, and then you will take your suction, aspirate about 10 to 15 liters, place it in the specimen cup, and we're going to test it with our pH strip. And pH should be about 1 to 5. That's how you know you're in the stomach. If you're not in that range, you're going to remove the entire tubing and you're going to start over. Okay, so once that is done, we're going to get a piece of tape, and we're going to tape this to the bridge of the patient's nose, and then we'll also secure it to the patient's gown with a safety pin. Okay, and you kind of just want to press those edges in so it's secure. Again, to confirm, you want to go ahead and do an x-ray, make sure you're in the correct location. You're going to go ahead and attach it to the suction source. If you do that, you're going to make sure you're maintaining suction, that everything is suctioning correctly, and then you're also going to make sure you're recording and document the contents that come out of that section. So the amount, how the drainage looks, the characteristics of what it looks like, and then you're going to make sure your patient is back in the lower your bed, your patient's in a comfortable position, everything's documented. So let me try and figure out that thing. Okay, and once you've done all that, you're going to remove your gloves and perform hygiene and document. Thank you.